Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh. I am also the medical author of the book Focused Neurology. Today we are going to talk about a very interesting topic, Cognitive Neurology Part 5. Aphasia Introduction Part 1. So Cognitive Neurology Part 5, Aphasia Part 1 Introduction. So aphasia and speech disorders. Introduction. Speech has been remarked that as human beings we owe a commanding position in the animal world by two faculties. One, language. Two, manual dexterity, the way we use our hands. So speech has been remarked that as human beings we owe a commanding position. We are placed highest in the hierarchy of the animal kingdom because of the two faculties. The language is very much human. No other animal can speak a language out. It is only human beings who've got language. Second, the manual dexterity, the way we use our hands. No animal can use the hands the way we manipulate. In fact, the representation of the fingers, the motor homunculus, is highest for fingers and face. So the motor homunculus has got the highest representation for hands. So the manual dexterity, the way we use our hands, and the language places us in the highest level in the hierarchy of the animal kingdom. So language is very much human, and today we are going to discuss this language and speech disorders. The introductory part. External speech, exophasia, versus inner speech, endophasia. External speech, exophasia. External speech, by which is meant the expression of thought by spoken or written words and the comprehension of the spoken or written words of others, is an almost continuous activity when human beings gather together. So when the human beings gather together, we keep on talking, communicating with others through language. That is external speech. Very interesting is that we also have an inner speech known as endophasia. Inner speech is the silent process of thought and the formulation in our minds of unuttered words on which the thought depends. It is almost incessant during our preoccupations as we think always with words. So whenever we are alone and preoccupied, we don't sit quiet. A continuous inner speech goes in our body. Unuttered words. Sometimes when we get too excited, what we think, the unuttered words become an uttered word. Sometimes we speak out also. When we are alone and preoccupied, a continuous speech is going on in our minds, in our body, the inner speech or endophasia. The thought process, we think of something else and then inner speech goes all in our body. It is in an unuttered way. It is in the inner body. But then sometimes when we get excited or too much involved with it, it may even become uttered. Sometimes you think something, and sometimes when even you're alone, you speak it out. So very fascinating, very interesting. So we have external speech, exophasia, and inner speech, endophasia, which is almost incessant during our preoccupations as we think always with words. Therefore, language and thought are inseparable. Language is a function of the cerebral cortex. Language is a function of the cerebral cortex. So language is a mechanism for expressing thoughts and ideas as follows. By speech, auditory symbols. By writing, graphic symbols. By gestures and pantomime, motor symbols. So by speech it is the auditory symbols. By writing, graphic symbols. By gestures and pantomime is the motor symbols. The internal manipulations of these symbols constitutes the thinking and the retention is the substance of memory. In neurologic patients, the speech abnormalities most often encountered are dysarthria, which is peripheral, and aphasia, which is central, related to the cortex. So, in neurologic patients, the speech abnormalities most often encountered are dysarthria, difficulty in articulation, which is peripheral, and aphasia, a language disorder, which is central. The essential difference is that language is a disorder, aphasia is a disorder of language, and dysarthria is a disorder of the motor production or articulation of speech. Articulation is one of the vital bulbar functions. Articulation is one of the vital bulbar functions, that is the brainstem. Brainstem indicates that several cranial nerves are involved in articulation or production. So several cranial nerves are involved in speech production. The trigeminal nerves control the muscles of mastication and open and closure of the mouth. The facial nerve, especially the branches of the orbicularis oris, control the lip movement. For example, saying pa. For saying pa, I need to use my lips. The vagus and the glossopharyngeal nerves control the soft palate, pharynx and larynx. For example, if I need to say ka, I need 10th nerve, vagus, palatal component, ka. The hypoglossal nerve, the 12th nerve, controls tongue movements, the movements of the tongue. For example, ta. So for saying pa, tha, ka, I need the facial nerve, vagus and the hypoglossal nerve. And trigeminal nerves involved in the control of muscles of mastication and opening and closure of the mouth. So several cranial nerves are involved in speech production, namely the trigeminal nerve, 5th nerve, the 7th nerve, facial nerve, the vagus, 10th and the 9th glossopharyngeal nerve, and the 12th nerve, hypoglossal nerves. The dysarthria can be classified as follows: the flaccid type, the spastic type, mixture of both flaccid and spastic, ataxic type, hypokinetic type, and hyperkinetic type. The flaccid type of dysarthria is because of the lower motor neuron involvement. Example, bulbar palsy. For example, if 10th nerve is involved, it becomes a flaccid type of dysarthria, bulbar palsy. The spastic type is an upper motor neuron supplying all these cranial nerves involved in articulation. For example, primary lateral sclerosis, which affects the upper motor neurons, which supply the cranial nerves involved in the articulation process. Sometimes it can be a mixture of upper motor neuron, that is spastic type, and lower motor neuron, that is flaccid type, which is known as mixed type. Example, ALS, amyotrophic lateral sclerosis, where both flaccid and spastic type are seen. Then we have an ataxic type, where the coordination of the muscles responsible for articulation are affected. Example, cerebellar. So when cerebellum gets affected, the coordination, the continuous fluent process of the production of the speech gets affected. That is cerebellar ataxia. It is known as ataxic speech. Sometimes it is also known as scanning type of speech. For example, instead of saying Chakravarti, they say Chakaravati. So it is an ataxic or scanning type of speech. Then we have the hypokinetic speech. Kinesia means movement. Hypokinesia means a decreased in the movement. So a decreased in the movement involved in the muscles of articulation, known as hypokinetic dysarthria, seen in Parkinson's disease. Second type, the other type is hyperkinetic type, a very fast movement of the muscles of articulation, known as hyperkinetic dysarthria, seen in basal ganglia disorders. Example, Wilson's disease. So dysarthria, the classification of dysarthria, we have flaccid type, example bulbar palsy, the spastic type, example primary lateral sclerosis, mixed type, example amyotrophic lateral sclerosis, a mixture of both flaccid and spastic type. We have ataxic type, cerebellar dysfunction. We have hypokinetic type, example Parkinson's disease, and hyperkinetic type, example basal ganglia and Wilson's disease. Yeah. So I discussed all the very important introductory concepts of speech disorders, aphasia. I hope you have enjoyed listening to my lecture as much as I have enjoyed giving the lecture. If you have any suggestions or comments, you can kindly post onto my YouTube channel. And almost all the important concepts of neurology, I put it in a question and answer format in a book written by me, Focused Neurology. It is available online from all the leading book sellers, including Amazon. If you are interested, you can book it online. If you have any suggestions or comments, kindly post onto my YouTube channel, Dr. Sreenivas Medical Concepts, or my email sreeklpm@gmail.com. But please and subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.